BRIDGEVIEW Family Medical Practice, located in Toongabbie, provides a range of primary healthcare and allied health services to the local community. The BRIDGEVIEW team includes nurses, GPs and a range of health professionals. Recently awarded a significant grant, BRIDGEVIEW is currently in the process of expanding their allied health services. This expansion will allow further treatment options and the provision of more multidisciplinary health teams to the local community.
My name is Shantini Seelan. I'm a GP and I'm one of the three main principals who run this medical practice. We've been in this area in Toongabbie for the past 10 years, working in a different practice altogether, and we started from scratch there. And over the last 10 years, we've gained a lot of experience, amassed a lot of patients, and found that the previous practice was a bit too small for us, so decided to move here. We started this practice with the main aim of offering optimal healthcare to our caring community, to our very regular and faithful patients, and we adopted a motto called Caring for the Community. And that is what we've been focusing on.
I'm Tava Seelan. I'm one of the directors of the BRIDGEVIEW Medical Practice, and we commenced our practice 3 years ago. We just completed our 3 years journey, and we have been fortunate enough to actually improve our service during these 3 years with the collaboration of the local division, the Department of Health and the local community. And it's been a success, and we are still striving to achieve more on the health promotion especially and also prevention of the illnesses apart from the illnesses treatment.
I'm Dr. Titus. I'm one of the three principals here in this BBMP practice, and working as a full-time GP here. Yes, we have joined quite a few programs so far, and that helped us a lot to run our practice effectively. As our motto is the caring for the community, so we really get a lot of the improvements of services for our community, right? So first thing I think I mentioned is the APCC, which is the Australian Primary Care Collaborator program we joined. That has been a very successful one. If I say what they involved, is it mainly the chronic disease management. So the one we have been working through with them is diabetes. Okay, so our community, for our patients community I'm talking about, it's very high prevalence of diabetes in the community. Even in our patients, more than 570 patients have diabetes.
My name's Dale, I'm a practice nurse. We see all the patients when they first come to the centre, all new patients, so we do a full workup of their general observations, height, weight, blood pressure, waist measurements, especially for the diabetics. We send letters for our chronic disease patients every 3 months, so they know they have to come in and have their checks done. We set up a system for recalls where the doctors mark in their pathology results to call the patient back in, so we send them a letter and let them know that they're due to see the doctor again. The patients are very good here. Mostly all of them will come to the treatment room on their first arrival because they know they have to have their observations done, which we record, and that saves a lot of time, and we know that we're getting them very regularly. All our diabetics get their reminders every 3 months where they come in and they have their full observations, height, weight, blood pressure and waist. They have their pathology collected, and this is all done through the reminder system. Chronic disease is something that's going to last a long time, and we want to prevent any adverse effects happening. So we want to try and keep them healthier at home longer than what we would if we let them go and forget about them. So it's better to catch them early and start treating early. So you have to look at the whole person, in other words. And it's not just, if they've got diabetes, what their blood pressure's doing. The patients talk to the nurses and they'll tell you if they've got problems at home, which could be a mental problem in a way that they need to be referred off to get some sort of help, or they're having trouble eating, so they need their dental work thought about a bit more. So you're looking at the whole body, and people come in and they'll say, Why am I having my blood pressure taken? I'm here just for a script. Well, we're looking after all of you, not just the piece of paper that you need. So they quite like that. They think it's good fun. I'm involved with a group with doctors, pharmacists discussing medications. I have given talks for WentWest on practice nursing. So yeah, I like going to WentWest. I like them up there.
My name's Maria Chowdhury and I'm the practice manager at BRIDGEVIEW Medical Practice. We excel in the way that we have allied health. We provide a dietitian, a podiatrist and physio to our patients. We look after so many different types of communities and it's important to educate them on health. A lot of them don't have the awareness that most people would have, so it's important to educate them, to guide them. We try and educate them on their health. We provide allied health here for them, a podiatrist, a dietitian and physio. We also run different types of programs. We've had diabetes clinics for our patients. We have had Measure Up come out and do bone density screening for our patients. Whatever we can, we actually offer it to them. There's a SHAPE program run by WentWest which we refer to. We manage these communications by working closely with WentWest and participating in all the evening sessions and ongoing programs that they have so that we can be educated and offer our patients the best in healthcare.
My name's Priya. I work for WentWest and I'm a practice partnership coordinator for BRIDGEVIEW. So at the moment we're working with BRIDGEVIEW very intensely for more of a collaborative approach than we had done in the past. So we're focusing on diabetes patients and we're wanting to better those outcomes. So ideally we used to come in probably once a month, but now we work on a more weekly basis with the practice. So we come in and do things like data cleansing their patient files, making sure that everything is ultimately, I guess, up to scratch, and which it always is with BRIDGEVIEW anyway, but at least we know where they stand. So from the beginning, we go through all those patients, make sure that everything's up to date, and then we look at their systematic approach, what's currently in place, what gaps there are, and then obviously we look at that and see if there's any way we can assist with them. So at the moment, within BRIDGEVIEW, there are a few different allied health such as diabetes educators. SHAPE is also from WentWest that will be coming in on a regular basis, but any gaps that they don't have, WentWest will hopefully be able to fill, and that's with the contacts that we have through our connections and networking. So in terms of processes for building blocks and getting, I guess, getting BRIDGEVIEW better than what they currently are, we have a lot of different services that we provide within WentWest. So I guess notifying BRIDGEVIEW of the services that we have available, for example, SHAPE, the diabetes programs that they're joined with at the moment with WentWest, and again, collaborative approach. So it's all about getting people connected to the right people for those patients that need to see physiologists, psychologists, psychiatrists, and getting them to constantly get in contact with them and communicate. So if there's no communication between the doctor and the allied health, then nothing gets done for the patient. So hopefully we're bridging that gap, and that's our plan. Very good, obviously. They're doing very well and they're going to expand their services in terms of allied health. So what they have in place is excellent and it's just going to get better from there. Having and allied health through their extension of the infrastructure will obviously enable patients to come on a more regular basis without having to travel too far, because sometimes patients don't access allied health due to logistical reasons or a whole lot of other issues. So if they're here, then they can straight away go and see those allied health.
I'm Kelly Grady and I'm the medical receptionist here at BRIDGEVIEW Medical Practice. I meet and greet the patients as they come in. I book them in to see the doctors, take appointments, answer the telephones. Yes, I believe the patients do notice the difference. They're not just left sitting out there like some practices. They're dealt with very quickly and they're kept informed of what's going on. Well, the programs that we use, as I said, it's to speed up the patient waiting time, so they've got less waiting time for the doctors. Triage faster with the nurses, any dressings, that sort of thing, they don't need to be seen by doctors, it's done by the nurses. So in that respect we have sped things up, made things better. They've enhanced their journey, I believe, because they've given them a more positive outlook rather than thinking, oh, I've got to go to the GP, it's going to be 5-6 hours waiting time, which some places can be. They know they come here, they're triaged quick, they get in to see their doctors, they're seen as close as possible to appointment times as well.
In primary care, prevention is the main focus. We do treat acute illnesses, but we want rather focus on prevention of illnesses. So when you talk about prevention, there's primary and secondary prevention. And in this practice, we just do that. We run a lot of health information programs in order to achieve those goals, to prevent primary and secondary complications. We have about 8,000 patients in our books, and they range from babies to the elderly. And we see a wide variety range of patients, and this is a very multicultural practice, a vibrant community, especially working in Western Sydney, and every day is a very different day, so you really don't know what's coming out through that door. As you know, in this day and age, chronic diseases are on the rise, especially like the poster behind me that says diabetes. We have about 484 diabetic patients on our list, and my passion is diabetes. My main aim is to prevent it. So how I do that is by organizing lifestyle management programs to educate patients on how to avoid these chronic diseases.
With even the pharmaceutical people, the companies, we have a good partnership with them, and we get even like a little fund or projects run through them. One of them, actually, we are doing it at the moment, is to run the diabetic clinics, right? For the patients. So we're actually connecting with the APCC, what we gained or gathered from them. Now we are actually in action with these people, okay? And also we already run another successful one through the pharmaceutical people, which is the osteoporosis screen. So we actually, over the age of 70, we get them to have a free, a van was here, and our patients come here and then have an osteoporosis screen, and then from that, we actually treat them accordingly. So that's the other thing. And the other thing is we have a very good partnership with WentWest, and through them we actually joined quite a few programs. The latest one is, I don't know if you all know about the e-health. Actually, we are part of their pilot study. We actually, it's proud to say, we are the successful recipient for the infrastructure primary grant, which is, I think, probably you know about the super clinic. Okay, so we actually very recently, we got the approval from the DA, the council. So we are soon to start. We are expanding from here to the, the next door.
We are trying to actually, trying to achieve a healthier population in this community. Therefore, actually, that partnership is very important, actually, and we actually not only actually involved with the patient-based system, but we are actually trying to achieve a healthier community. It's a comprehensive actually services actually in a practice which actually has multidisciplinary services with the dedicated staff, and we are trying to achieve this in a team-based approach actually.
So when you have partnership with these people, we can get the resources and even the fund, and to use that to tailor it for our need, to run our business. And then when it says to run our business, as always we mentioned, our motto is to caring for the community, right? Our patients. And so how we can, with the partnership of these services, how can we get the resources, the fund to help the community, our patients, as already I mentioned, And then through the partnership of the pharmaceutical company, we are running the clinic now.
When we are in need of staff, especially in the case of clinical staff, we are fortunate because we are actually a training practice. So we do a lot of training. So we train from undergraduate to postgraduate students. So we take in a lot of medical students, final year medical students. We take in a lot of registrars who come here and train with us and end up staying with us. And when they come in with us, we sort of suss them out and see if their focus is really on primary care. So that's what we want to do. And in order to be a good primary care physician, you got to love the job, you got to love your patients, you got to understand and have a lot of empathy for them. So we are interested in people who have the same feelings, like-minded individuals who feel that the same way as we do, and would go that extra mile to provide that extra healthcare to our patients. So when people come in as registrars, they train with us, they like the way we work, and they're happy to stay back. In the case of clinical, so we do not have a problem in that area. With the admin, we have a really good practice manager, and we have a really good system. So even with admin, because they are the ones who either make or break the practice. For example, the receptionists, they are the first point of call when patients come in. So they have to make sure that they project the right image. So when they come in, we make sure when we have a really a very detailed interview, finding out why they want to be in this job, and if they do come in, they have to make sure that they adhere to our ideals and act accordingly to how we want them to act. So we want to make sure that working in BRIDGEVIEW medical practice is something to be proud of, and we want them to be proud of what they are doing and feel that they are actually making a contribution to the community.